Dr. Service, what do you think are the greatest challenges with respect to the training of future psychiatrists?
Well, I think the challenge that we're wrestling with in our own program is providing our residents with the foundation in neuroscience that we think will be relevant to the future practice of psychiatry. And doing so while hanging on to the very important foundations that we have in psychotherapy training, in fundamental diagnostic skills and assessments, in psychopharmacology. And so one of the challenges that I've seen as a training director as we move forward is that the knowledge that is needed to practice in a state-of-the-art way as a psychiatrist is always expanding, and there are always advances. And to incorporate those into a residency training program while not losing the core foundational skills that are already part of the training is where the challenge lies. Because, in many ways we're just packing more things into the same 4 years of training. So we have to find ways to do it more efficiently and effectively, more synergistically, and I see the addition and particularly the expansion of knowledge in neuroscience as being the single largest additional piece that we're trying to assimilate at this point. It's not to say there aren't advances in the other areas of psychiatry, and some of them are very significant. For example, our very increased understanding of cultural issues as they relate to both diagnosis and treatment of patients. Much more now in training about gender issues in health and women's issues in particular. And so adding these things into the curriculum without losing, again, the core foundational training that we've always had is it's a difficult task. But it's an exciting one. And the neat thing about being a training director and an academic psychiatrist is you get to keep learning along with the residents. You have to stay current, and so it's a stimulating process.